Good morning, everybody. Today's topic is desquamative gingivitis. First of all, what we understand by the word desquamative is loss of epithelial elements in small or large amounts that includes peeling of skin and exfoliations. And the term gingivitis you already know, it is the inflammation of the gingiva. We will include introduction, etiology, clinical features, histopath, differential diagnosis, management. First of all, we will start with the introduction. Specific or non-specific entity given by Tomes in 1884, Prince in 1932, and Massler in 1947. Classification includes dermatosis, hormonal, idiopathic, chronic infection, and irritation. Etiology given by different persons. Dermatosis was given by Nizengard. Hormonal was given by McCarthy. Aging by Godabi. Metabolic was Ziskin. And nutritional by Roth. Systemic diseases, chronic infections, immunopathologic, allergic, and idiopathic. Etiologic distribution includes 75% of the dermatologic origin, and lichen planus and cicatricial pemphigoid includes 60%. Now we will start with the clinical features. It includes distributions, non-specific characteristics, and specific characteristics. Distribution includes female frequently, age varying from 40 to 55 years. Both the arches are included, bilateral, marginal and attached gingiva is included, facial gingiva frequently, and dentulous frequently. We will also include appearance, pain, bleeding. First sign of desquamation is Nicols's sign and repeated episodes. Specific features of lichen planus: 10 to 20% oral lesions. Pemphigus and pemphigoid includes 20 to 30%. Histopathology includes epithelial loss, formation of ulcer, edematous chorion, leukocyte infiltration until we will increase vascularity in the epithelium. Now, when we go for histochemistry, it includes type 4 collagen antigen, basement membrane antigen, and basement membrane disintegrated. It was checked by and given by Anjol et al. And Foss in 1953. Histopathology of specific features includes pemphigoid. It will show degenerated epithelium, basement membrane absent, lack of epithelial adhesion, and leukocyte infiltration. This is the picture of like pemphigoid. The histopathology of pemphigoid includes degenerated epithelium, basement membrane absent, lack of epithelial adhesion, and leukocyte infiltrations. Now, what we see in lichen planus, the first sign is acanthosis, hyperparakeratosis, saw-tooth retipex, lymphocyte and plasma cells, and degenerated basal cells. Pemphigoid includes suprabasilar split, intercellular bridge loss, and the most common is Zank cell is present in acanthosis. Now, as we move forward, we will see the differential diagnosis. It includes erosive lichen planus, mucous membrane pemphigoid, pemphigus vulgaris, erythema multiforme, and stomatitis medicamentosa. Lastly, the treatment plan for desquamative gingivitis, it includes the first line of drugs with a high potency corticosteroids we will use in addition with to the adhesive gels clobetasol. Now, the second line of drug choice includes minocycline, doxycycline, tetracycline, or in combination with erythromycins, penicillins, dapsone, and sulfonamides. We can also use topical immunomodulators, that is tacrolimus. And last but not the least, the third line of drug will be systemic immunosuppressants, that includes rituximab, interferon gamma, or anti-interleukin 17 drugs. Thank you.